Greetings family. In today's knowledge, let's talk about how do you get strep throat. Watch till the end as I talk about what first signs of strep throat are. Does strep throat come up with a rash? What is the strep throat incubation period? What is recurrent strep throat? Everything you should know about the highly contagious illness. As colder weather blows in, changes in temperature mean it's the season of sore throats. But not all sore throats are equal. Some are caused by viruses while others are caused by bacteria. Such is the case with strep throat, a dreaded illness which, while medically mild, can be painful. While the United Kingdom has reported the deaths of 6 children due to strep A, here's everything you should know about strep throat, from symptoms to treatment to spread. What are the first signs of strep throat? The first symptoms of strep throat are often a sore throat, pain when swallowing, and a fever. The CDC reports that other common symptoms of strep include red, swollen tonsils, with white spots and pus at times, petechiae, small, red spots on the roof of the mouth, swollen lymph nodes on the neck. While these are the most common symptoms, strep infections can also cause vomiting, stomach pain, and nausea, as well as headaches, especially in children. Does strep throat cause coughing? How about congestion? Neither coughing nor congestion are common symptoms of strep throat. Children and teenagers with strep throat do not usually have symptoms of cough or congestion. These symptoms would be more typical of infection with a respiratory viral infection. Is there a strep throat rash? Sometimes. In certain cases, a strep infection can result in a rash referred to as scarlet fever. Some children with strep throat can develop a sandpaper-like rash. This is suggestive of a diagnosis of scarlet fever. Group A streptococcus, which causes strep throat, can also sometimes produce a toxin that causes a rash, red skin with a rough feel to the touch. The rash is likely to first appear on the neck, underarm, and groin. The CDC reports. Over time, it can spread to the rest of the body. How do you get strep throat? Strep throat is a highly infectious bacterial infection. It is spread from person to person through direct contact, and through respiratory droplets. The CDC reports. You get strep throat from spending time with someone who already has it. In rare cases, strep can be spread through food that is improperly handled. A person can catch strep throat by breathing in respiratory droplets that contain the bacteria, touching a surface that has that bacteria living on it, and then touching their nose or mouth, sharing food or drink with a person who has strep throat, touching a sore that someone infected with strep has on their skin. What is the strep throat incubation period? The incubation period for streptococcal pharyngitis is 2 to 5 days. What is recurrent strep throat? There is no vaccine for strep throat, which means it's possible to get it more than once. You are also not immune once you've had the infection, making recurring strep even more possible. The best way to prevent again reinfection is to practice good hygiene. For small children, if recurrent strep throat emerges, some doctors may recommend tonsil removal. The surgery, called a tonsillectomy, is usually only recommended if your child is getting strep 7 or more times in 1 year. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.